Infectious disease, bloodborne pathogens, and universal precautions. This lecture will include an introduction to infectious diseases, the stages of pathogen infection, common infectious diseases, immunizations, bloodborne pathogens, universal precautions, standard precautions, preventative measures, disinfecting and cleaning procedures, the differences between cleaning products, and references for the slides. We'll start with infectious diseases. In order for infectious diseases to occur, there must be an invasion of a host by microorganisms called pathogens. Pathogens cause disease either by disrupting a vital body process or by stimulating the immune response. The most common pathogens are various bacteria, viruses, parasites, or fungi. An infectious disease is termed contagious if it is transmitted from one person to another. The transmission can either be direct or indirect. In a couple slides, we'll discuss the difference between direct and indirect transmission. Direct transmission. This can occur through either contact between body surfaces, droplet spread, or through fecal-oral spread. Contact between body surfaces most commonly occurs through touching, but may also occur through sexual intercourse. Droplet spread may occur through the inhalation of contaminated air droplets from someone in close proximity. Fecal-oral spread. This occurs when there is feces on a host's hands and they are brought into contact with a new host's mouth. Indirect transmission. The pathogen travels by means of an inanimate object. This may include things like water, food, towels, clothing, or even eating utensils. This can also occur through vectors, things like insects, birds, or even animals, or may occur as a result of an air source, such as sneezing, or through wind. Pathogen transmission. Pathogens can enter the body through the skin, the respiratory system, the digestive system, or even the reproductive system. Whether or not a pathogen will infect a new host is determined by the acquired immunity of the individual, the overall health of the individual, and the health-related behaviors of the individual. There are 5 stages of infection that occur. These include the incubation stage, the prodromal stage, the acute stage, the decline stage, and the recovery stage. We'll dive into each of these in a little more detail on the following slides. The first stage of infection is the incubation stage. This lasts from the time a pathogen enters the body until it multiplies to the point where signs and symptoms of a disease begin to appear. This stage can last anywhere from a few hours to many months, depending upon the concentration of the organism, the virulence of the organism, the level of the immune response of the host, and the presence of additional health problems. During this stage, a host may be infected, but is not considered to be infectious. This is why you are often asked if you've been sick or you think you're getting sick prior to getting a vaccine. Vaccines don't make you sick. You were already sick prior to getting a vaccine. The predominant stage. There's a variety of signs and symptoms, such as watery eyes, runny nose, a slight fever, malaise, or extreme fatigue, that all may briefly develop. During this stage, the pathogenic agent continues to multiply and the host is capable of transferring the pathogen to a new host. The person should be isolated to prevent transmission to others. This is why we often urge you to stay home when you're feeling sick. During the acute stage, the disease reaches its greatest development and the likelihood of transmitting the disease to others is the highest. Your body is resisting further damage from the pathogens. At this point, your immune system is really hard at work, people. Next comes the decline stage. The first signs of recovery appear signaling that the infection is ending, but a patient can experience a relapse if they overextend themselves. Typically during this stage, the fever finally breaks at this point, and you may start to return to your normal body temperature. You want to take it easy and rest. Overdoing it can prolong your illness. Last is the recovery stage. This is characterized by an apparent recovery from the invading pathogen. However, since the overall health of the patient is compromised, the patient may still be susceptible to other pathogens. Following the recovery stage, subsequent exposure to that pathogen may not result in an infection, since the body has built up an immunity. However, it must be stressed that immunity is not necessarily permanent. It is also important to note that the patient may still be susceptible to other illnesses during this time. Immunity. This occurs when the immune system successfully eliminates the effects of an invading antigen. The body is primed to respond quickly and effectively should the same antigen appear again. We have a couple different types of immunity. We have innate immunity and adapted or acquired immunity. Innate immunity is present with people at birth. This is the body's baseline immunity response. Adapted or acquired immunity is the immune system is fighting off invading antigens and develops antibodies. This can be developed artificially via vaccinations or vaccines. Let's cover some of the common viral infectious diseases. This includes varicella, also known as chickenpox, coronaviruses, also including COVID-19, Ebola, hand, foot, and mouth disease, hepatitis A, B, C, D, and E, human immunodeficiency disease, also known as HIV, acquired immunodeficiency syndrome, also known as AIDS, and influenza, also known as the flu. Common bacterial infectious diseases include anthrax, bacterial meningitis, gonorrhea, impetigo, Lyme disease, methicillin-resistant Staphylococcus aureus, also known as MRSA, pertussis, also known as whooping cough, shingles, and tuberculosis. We also have parasite and fungal diseases. The most common parasite infections include malaria, scabies, and pinworm infections. The most common fungal infections include candidiasis, also known as a yeast infection, and tinea pedis, also known as athlete's foot. Immunizations are often given to help minimize the incidence of childhood communicable diseases. Immunizations have eradicated many infectious diseases worldwide. Smallpox, for example, has been eradicated due to the development of a vaccine. Most healthcare facilities will require employees to be immunized for hepatitis B, influenza, meningitis, Tdap. The Tdap vaccine includes diphtheria, tetanus, and pertussis. And some facilities will also require other vaccinations. There are some exceptions to this rule. This may include certain pre-existing health conditions where vaccines are not recommended, allergies to a vaccine or vaccination components, or religious exemptions. You need to be mindful where you obtain your information about vaccines. Make sure that that information is coming from reputable sources. Diseases with vaccinations. That includes tetanus, diphtheria, and pertussis, or the Tdap. This can be administered all at once in one vaccination. Hepatitis B has a shot, so does COVID, influenza A and B, rubella, also known as German measles, and the measles, polio, mumps, and the chickenpox. Smallpox has been eradicated, and the vaccine has not been administered in nearly 30 years. Some good things to prevent the spread of infectious diseases. Wash your hands regularly, keeping your hands away from your face and mouth. Keep immunizations up to date. Prepare and handle food correctly. Use antibiotics only for infections caused by bacteria. Be careful around wild animals and unfamiliar domestic animals. Avoid insect bites when possible. Protect yourself by using safer sex practices when you can. Do not inject illegal drugs. Stay alert to disease threats when you travel or when you visit other countries. And develop healthy habits, eating well, getting enough sleep, exercising, and avoiding tobacco and illegal substance use. We're now going to transition into bloodborne pathogens. The definition of a bloodborne pathogen is a pathogenic microorganism that's present in human blood or bodily fluids that can cause a disease. There are different modes of transmission, which include human blood, synovial fluid, which comes from joints, semen, vaginal secretions, and even cerebrospinal fluid. Common bloodborne pathogens that most healthcare workers can come in contact with include hepatitis B, there's a vaccination available. Hepatitis C, there's no vaccine available. Human immunodeficiency virus, no vaccine is available currently for this. These are the three most common bloodborne pathogens. Fortunately, the transmission in active settings is low, and there's minimal risk for on-field transmission. Individuals can still participate in sport if they are HIV positive. The biggest key to preventing bloodborne pathogens is using universal precautions and having an exposure control plan in place if they do occur. We'll talk about universal precautions on the next slide. A universal precaution. This is an assumption that any body fluid or blood is potentially infectious. Blood or any bodily fluid is also known as other potentially infectious materials, or OPIMs. Never clean up blood or bodily fluids without gloves. OSHA, also known as the Occupational Health and Safety Administration, established universal precaution guidelines in 1991. This was for employers to follow to help reduce exposures to bloodborne pathogens. It is also important to have an exposure control plan. In the event that an individual comes in contact with blood or other potentially infectious materials, OPIMs, there is a documented plan that includes education, volunteer testing, management of bodily fluids, and counseling in an exposure control plan. Standard precautions. Personal protective equipment should be worn by individuals in the healthcare setting. This includes gowns, gloves, face masks, respirators, face shields, and goggles if you're going to potentially be coming into contact with blood or bodily fluids, depending on what fluids you may come in contact with. Having the right PPE for the job is extremely important. As we've discussed, preventative measures are extremely important. Good personal hygiene, such as washing your hands, is extremely important. Practicing universal precautions, using gloves, and assuming all known fluids are infectious is important as well. Hand sanitizers, while it's a good use, should be used as a temporary solution until you can actually wash your hands with soap and water. Getting proper rest and having access to well-rounded nutrition can also assist in reducing the risk of illness and injury. Taking care of yourself before you can care for others is vital. As healthcare workers, we're sometimes not very good at this. If you're in direct contact with patients, you must use appropriate equipment. This includes gloves, gowns, aprons, masks, shields, eye protection, and disposable mouthpiece for pocket masks. An emergency spill kit for blood should include, at minimum, nitrile gloves, a resuscitation mask, gauze, and towelettes for cleaning skin surfaces. Any towels or other linens contaminated with blood or other bodily fluids in a healthcare setting should be bagged and separated from other laundry. Contaminated laundry should be washed in hot water, at least 159 degrees Fahrenheit, for at least 25 minutes using a detergent that deactivates the virus. That includes blood and any other bloodborne pathogens. Gloves must be worn during bagging and cleaning of the contaminated laundry. Disinfecting and cleaning procedures. Contaminated surfaces should be cleaned immediately with a solution of 1:10 ratio of approved disinfectant. That may include bleach to water. Other disinfectants may include hydrogen peroxide or a solution of 70% ethanol. You need to follow the directions on the disinfectant bottle. Some products may need to sit on the contaminated surface for up to 10 minutes to fully kill the pathogen, so it is important that you read the directions on the bottle. What are the differences between disinfecting versus sanitizers versus cleaners? A disinfectant kills the virus and the bacteria on the surface. Sanitizers kill the bacteria on the surface using chemicals, but it does not kill a virus. Cleaners remove dirt, organic matter from the surface using soap and a detergent. If you're concerned about your environment, the EPA, the Environmental Protection Agency, has a search tool that's built in to see if it aligns with their Safer Choice certified products. There's a link on the reference side if you'd like to look up your products. Here are some products that you may use at home. You may want to look at them a little bit closer. Are they a cleaner, a disinfectant, or a sanitizer, or a combination? Whizzer is a really common product used in healthcare clinics. You can see that this is a cleaner, a disinfectant, a fungicide, a mildewicide, a viricide, a deodorizer, and a concentrate. So essentially, an everything-icide. This pretty much kills a lot of things. We use this to disinfect non-porous surfaces such as athletic equipment and training tables. We can use this in athletic locker rooms and exercise facilities. Whizzer's another common product that should sit on a table for at least 10 minutes in order for it to fully work and kill the virus. An application of our learning. I know this is a digital lecture, but I want you to kind of think about what we've talked about so far. In the next few pictures, I would like for you to have a little internal conversation and see if you can apply some of our learning. What do you think is wrong with this picture? Are there gloves on the hand? No gloves. We're inserting a needle into someone's ear. Is there a problem with this picture? Is this picture any better? The clinician is the gentleman in blue. The patient is the individual in white and red. The gentleman in blue has one gloved hand. Maybe it's a little better than the needle picture before. Is it fully better? Would you like to see gloves on both hands? What about this? How should this be handled? This was Curt Schilling's sock. He was pitching in the 2004 World Series. So on October 19th, 2004, Curt Schilling took the mound with a bum right ankle in a do-or-die playoff game for the Boston Red Sox against the New York Yankees. He had torn the tendon sheath before the game, and the doctor had stitched him back together. But as he walked onto the field, blood began to soak through his sock, forming a big red stain just above his Reebok spikes. Schilling pitched through the pain to help the Red Sox win the game. The blood-stained sock became an iconic image for perseverance, heart, and all the other sports cliches you can muster. There were 2 bloody socks that night. One was actually thrown in the dumpster, and the other one ended up here in the Hall of Fame. Is that where it should have ended up? We just talked about laundry. How should this have been handled? Another critical thinking question. You have an athlete who is going up for a rebound in a pickup basketball game when she was elbowed in the face and she starts bleeding above her eye. What are some universal precautions that you should use? What personal protective equipment should be used when treating this individual? How should bloody gauze be disposed of? What if you found out that there was a rip in your glove following the treatment of the athlete and you had a scrape on your hand? Would you be concerned about contracting a bloodborne pathogen? And would that change if you suddenly found out that the patient was HIV positive? The last thing I'll leave you with is the references. Here's some information in case you want to look up more information about what we've discussed today.